Spears. I'm the medical director and founder of Living Hope Eating Disorder Treatment Center, and we're going to talk today a little bit about keeping the joy through the holiday season in your recovery.
And I'm Alyssa Cheney. I'm one of the therapists here.
I'm Kristen Kren, one of the registered dietitians here as well.
So, can one of you talk a little bit about restricting during the holidays and kind of what that looks like?
Sure. There are some triggers that might potentially occur during the holidays. It seems to be a time where people they feel pressure to live their best lives, or show their families that they've improved over the hiatus at seeing them. So there can be some urges to restrict or do other behaviors during the holidays. And it's really important for patients and anyone to remember that it's important to eat frequently throughout the day to prevent other behaviors from happening, as well as to kind of stay on track with your treatment plan. Any other thoughts?
I think, over the holidays, there's a lot of social pressure to engage in dieting behavior. There's the whole New Year's resolution thing, and I like to encourage patients to do something called flip the script. So, if normally you would sort of engage in that diet talk, instead you're going to make other choices. You're going to say, well, this year I'm going to work on getting stronger, or I'm going to work on following my meal plan, or I'm going to work on giving myself 3 positive affirmations a day. And so in that way, we sort of flip the way that we're thinking about the holiday season and kind of what New Year's resolutions could be, instead of having it be something that could be triggering for eating disorder behavior.
Kristen, can you talk a little bit about following your meal plan, that kind of thing?
Sure. I think it's really important to follow your meal plan to your very best potential over the holidays to stay on track. You're still doing the hard work, and that doesn't really ever end. The holidays is not an exception, although it can be really encouraging to get off track and maybe save up for this meal so that this meal is a little easier, so that your anxiety is lower. But just keep in mind that doesn't ever work. You tend to fall off track and then feel more overwhelmed if you do that. There is some flexibility that can happen. Remember that the holidays need to be flexible in general so that that joyful mindset can stay. But also, if you for some reason cannot get to your snack immediately at 3 o'clock, as you've been doing it for months, do it as the next time that you can, or plan ahead, of course, right? So you can bring your snack with you. You can try to figure out where you're going to be, who's going to be doing what, and see if the snack might fall there, because there's going to be food around for you to have, and that can count towards your meal plan. Don't forget that. As far as meeting the exact portions, you can plan ahead with your dietitian to kind of figure out maybe some things that you wouldn't normally do. Say that you haven't really had cookies in a while, and you want to talk about how many exchanges those are to fit your snacks exchanges. Planning ahead can help you decrease the anxiety to meeting the meal plan. It'll go a lot easier. I've seen that be pretty helpful.
Dr. Sears, can you talk a little bit about how important it is to continue treatment and not skip appointments during the hectic holiday season?
Sure. I think that the holidays are a very hectic time for a lot of people, and there's a lot going on, and so a lot of times it can seem like it could save you time to just not go to your appointments for a little while. But the holidays are also full of a lot of triggering things for people. There's a lot of events where we're expected to go to those events, and there's a lot of events surrounding food that we're expected to go to. We're also expected to go around our families a lot more than we usually do, and friends that maybe we haven't seen in a while. And then sometimes there's comments that can be made inadvertently that can be really difficult to hear, or can be triggering for us. And so I think it's just very important to make sure during the holiday season that you have the support of your treatment team. So to make sure that you're checking in with your dietitian frequently, as well as with your therapist, so that you can talk through these things and try to come up with a strategy for how to get through the holidays unscathed and still in a good place of recovery. I think there's a lot of pressures, again, like I said earlier, socially, to engage in behaviors over the holiday season. And there's just a lot of talk about food and good and bad food and just all sorts of things that are just very difficult to kind of hear. And so that's good to have an outlet to be able to talk through that so it doesn't trigger you to go back to your disorder. And then come January, you're in a really serious relapse, and then you need more treatment, which is what we would like to try to help people avoid, because we want you to be able to enjoy the holidays and be able to have a good, fun holiday experience, and be able to do that without basically crumbling under the pressure of societal weight.
Alyssa, can you talk a little bit about how important it is to have a good support system, and then kind of some of the triggers and stressors that people face during the holidays?
So there's a lot of triggers that you may or may not experience over the holidays. Those can include different people in your family who you're not really looking forward to seeing, maybe an aunt or uncle who so happens to mention maybe weight that you've put on, or basically just kind of any comment on your body in general. And it's important to make a plan ahead of time for that. And how you're going to react to those things and how you're going to handle that situation.
Kristen, you talked a little bit earlier just about working with your dietitian. Can you talk a little bit about maybe, getting the menu ahead of time? Is that a good idea? Working through that with your dietitian, that kind of thing?
Absolutely. We like to plan ahead. In fact, I feel like that's most of what we do during session. We're here to support you that way. So utilize it. Call ahead. If we'll help you call and get the menu from grandma or aunt or wherever you're going. See what they're making, see what's going to be there. I'll help you put together an idea of how much of what to have. If you don't know what's going to be there, I've had patients bring their own food. It may sound awkward, but no one ever notices. And if they notice, then, if you care enough about them to explain to them, like, I needed to prep ahead, this is how I'm going to be healthy right now, and maybe later on, being more spontaneous with eating, but for now it's pretty regimented. If you don't trust them that much, you're not really ready to tell them all that. Just having some kind of backup plan, whether it's, we're only going to stay a couple hours, or, with your support system that you're going to have, just deciding ahead of time what's going to happen if you need a backup. Other things to note, it's really important to not save up for the big holiday meal. That is never a good idea. It never leads to anything positive in recovery, or for those generally who are not in eating disorder recovery, it doesn't help them either. So don't skip breakfast. Don't make sure you go get your workout in before the meal. That just feeds into your eating disorder and creates problems later on. Planning is really, really important, and backup plans are really important. It's also, it's really important to also note here that food is just one part of this. It's one aspect of life, and you should be focusing on your time with your family, the joy that's there, the memories that you're making, and your eating disorder is trying to interfere with that. So as much as you don't let it, the more memories you can make, and just remember that's going to get easier. It won't always be this hard to eat at these functions. I hope that makes sense.
Another thing that we've done before that I just want to mention too is that sometimes if it seems just you've met with your treatment team, you've talked to your dietitian, you've talked to your therapist, and the idea of going to Thanksgiving dinner or Christmas dinner is just very overwhelming, because there's going to be a plethora of food and you're not going to know what to pick. We have encouraged people before sometimes to pick a safe person in their life that they know is going to be there. So maybe their mom or their husband or their, aunt or grandmother that they're close to, and say, hey, I really don't think that I can plate my food very well, and could you just do that for me and just set it down for me? And that can help too sometimes, and it can take the pressure off of you feeling like you have to go and yourself pick the food and put it up and put it on your plate. And so if that's a struggle that you just don't think you're going to be able to do, and that you feel like might lead to like a meltdown for you, it would be better to just identify that person and just say, hey, it would be really helpful for my recovery if you could do this for me. And no one ever notices that. It's really normal for a parent or a spouse to just sort of get something for their family member, and so it'll just be something nobody else will notice, but it could help you have a better day.
All right, and lastly, can all of you kind of just talk about being on social media, just the influence from social media, people posting pictures of their holidays, the food they're eating, and then also if someone can kind of touch on just like the desire to possibly use the scale more during the holidays and what you guys recommend about that.
Well, I think we know that social media can be dangerous in the way that we often use it as a comparison tool. It sort of will feed in on that already sort of present want or need to compare ourselves to others, and it sort of just exacerbates that whole identity of, you know, sort of comparing maybe like your family's situation.
I'm going to also add to that to put away the scale, bring it into your team, give it to a loved one to hide. The scale is not on your side. During this time, it can only encourage more behaviors to occur. So we were just talking about this. Either, you know, if you don't like the number, then that causes restriction or behaviors to happen. But if you go the other way and you do like the number, that might compel you to do those things further too. So it's really not a good tool for you. And to also not measure your worth based on that or any of your clothing. There's a lot of pressure to look a certain way in a certain type of clothing, or, you know, whatever the event calls for. You are more than that, and the people who want to see you, whether you still fit in those pants or not. Getting rid of those and, you know, letting that be something of the past and moving on is really going to support you. And it's going to allow you to have other memories created versus memories of feeling a certain way about your body this season.
Yeah, and I just want to add that along with that, I think we put so much emphasis as a society on the one vital sign of weight, and no one does that with any other vital sign. And I talk to my patients about this all the time. Nobody cares if their blood pressure is 122 over 72 or if it's 120 over 70. No one cares. Nobody cares if their pulse is 75 instead of 70. Nobody cares. But when you talk about 1 pound of weight change, people care a lot. And, you know, the number on the scale isn't what defines you. It's not what makes you healthy or not healthy, you know, except in very, very big extremes. And our bodies fluctuate and things like that over time. And we're much more concerned about the wellness of your body and mind in total and not the number on a scale. So I think it's just important to say that that's not going to be what you focus on this holiday season, and you're going to allow yourself the freedom to choose foods that you enjoy and to eat those mindfully and intentionally and have fun with food again and not let it control you anymore. And that's what we're trying to get at, I think, through the holiday season. So, you know, if anybody feels like they're struggling and wants to come in and be seen maybe going into the holiday season and hasn't been seen for a while, or maybe you don't have a treatment team yet, we would love to help you. We would love for you to be able to have a really good, complete, healthful holiday season, and for going into 2020 for you to have freedom and health. So if you want to, you could call us. Our phone number is 405-801-2323, and we'd love to set up appointments, and you could see any of us here, or we have other people on our team as well that would be very happy to see you, and we'd love to help you. Our website is also www.livinghopeok.com. So, you know, we hope that you have a really healthy, happy holiday season, and we hope to see you soon.